The Mahogany Project is a project with Healthy Mothers, Healthy Babies of Broward, and it's funded by the Broward County Social Services. And what it is a program that works in the 33311 zip code, which is a really at-risk, intense population. And what we found out a couple of years ago with that, our babies are dying, Black babies are dying twice as any other babies, and more specifically in this zip code. And what happened was they did research and 40% of the deaths were preventable. However, the services that were not showing that the prevention was occurring. So what happened was Healthy Mothers got together with some other collaborations and created this program. And what we are a program that's housed in that community for that community, and we provide intensive childbirth, breastfeeding, and parenting, as well as constant communication with the medical homes. In the context of Best for Broward Babies, Mahogany is really working in collaboration with them because it's some of the same population that we're serving. We're actually using some of our Mahogany clients as some of the lay health advisors with the Community Voice program. And they went through the intensive training last week, which was like 9 hours of education about prenatal care, father involvement, and they really are certified now as trainers. Now they're in the process of going back and train other people in the community and help spread the word about the racial disparities and how we can reduce them.
Okay, their passion for both Mahogany and for the Best for Broward Babies is really heartwarming and so critical to its success. Of course, Best for Broward Babies has 3 components. Jennifer, can you talk about those 3?
Well, the 3 components are Community Voice, which is a training that we are just launching now, and it's a grassroots campaign to go out into the community to dispense information through peer educators, 100 peer educators, hitting the streets of our high-risk zip codes, educating anybody and everybody we come into contact with about prenatal care, safe sleep for your baby, father involvement, decreasing stress, everything that they need to have a healthy pregnancy and help that baby celebrate their first birthday and live much, much longer and grow up into healthy, contributing citizens in our community. The second component is fatherhood, which we're so excited about. It's been so successful, and Sam can talk about that.
Yes, Sam, please. With a table full of women, it's tough to get a word in edgewise. Tell us about fatherhood.
Okay, Cindy. Yeah, the fatherhood program is geared towards fathers in the 33311 as well as the 33313 and 33319 communities aged 20 to 39. And what we do is have the fathers come out. We meet once a week for about 2 hours where we have dinner, and we have a different presenter that comes out and speak about different issues and topics that the fathers may need to be educated on, such as life skills. We had an actual lawyer that came out and spoke with the fathers about their legal concerns, as in child support and things of that nature. We also had someone come out from OIC to talk about family relationships and how they can better their relationships with the mother of their children for the sake of their children, whether they're going to be together in a relationship or not. The program's going really well right now. We're headed into week 10. We started with over 40 fathers, and now we have still 36 fathers. We're looking forward to have a high graduation rate. We actually took a recreational activity where we went out deep sea fishing and caught like 28 fish. We have success stories coming in. I have like 3 fathers that were unemployed at the start of the program. Now they're employed. We had ATI come out a couple of days ago, and just from Wednesday to today, which is Friday, in those 2 days, I had 3 fathers that took the opportunity, went and passed the pre-test at ATI, and now they're about to be enrolled. So things are going well. We're geared towards getting the fathers involved in their children's life, getting them to be involved in the early stages to where they can tell that mother to go get that prenatal care, make her stop the bad habits and help her out around the house, remind her to put the baby on the back. So whatever we can do to help the Best for Broward Babies here.
Now, for those who may be watching and say, what do you know about fatherhood? I think you're kind of a success story yourself.
Yes, I am a father of 4. I was a teen father in high school, Dillard High School. I had a lot of challenges and obstacles that I had to overcome with, especially leaving and going off to college for 5 years and leaving back my twin daughters who weren't even 1 year old at the time. So, as I went to college and growed and came back home, I really sat down and really started to understand myself as a young man, as a father, and just concentrating on leaving a legacy behind for my children and being a bigger man in situations to where I act accordingly. And these are the things that I went and recruited these fathers from off of the street corner in the middle of the daytime, 11 and 12 o'clock. And I just sit down with them and I talk to them about being better men for their community and being there for their children to just, like I said, try to make the best for Broward as a community, and especially for the children, because they are our future.
We heard Dr. Osgood talk about how we have so many non-traditional families now. And how do you address that with the dads? How do you help them, regardless of whether it's their biological child or not in the home, and what's happening there? Or if they're not living with the mother of their child.
A statement that I use with my fathers all the time is to tell them to be the bigger man, to be the man. You know, when we brought them in, I sat them down, as I said, and one of the main things that we wanted to do was erase the stereotypical ways of the community and the world thinking of fathers as being deadbeat, or they're no good, or they don't have jobs and they don't want to do anything but stand on the street corners. I want people to start thinking about men and fathers as role models, executives, teachers, and something that our children can look up to for the future.
That's great. I want to get back to the third component. Jennifer, the third component we didn't get to mention yet.
Well, before we do that, I just want to say that's one of the amazing things that's already come out of Best for Broward Babies through this fatherhood is it has really opened our eyes, especially me as a healthcare professional, to really get that message out there. It takes two people to make a baby, and we always focus on the mom, healthy baby. It should be a healthy dad, healthy baby also. It's the dynamic that occurs between all three of those players there that make, a good outcome for that baby. So it's been so exciting, and we're so proud of all the work that has already come from this fatherhood project, and we're hoping that we can see it go on and on. Which leads me to my project, model behavior, because we found from talking to people in the community, they were getting the wrong messages from our delivering hospitals in this county. There's 8 hospitals that you can have your baby at, and there has never been a consistent message across the board through the whole county about safe sleep. And we're not just talking about back to sleep, we're talking about creating a safe sleep environment for your baby, making sure that the baby is on their back always in their crib for each and every sleep, but no bumper pads, no loose bedding, no pillows, no toys, no co-sleeping with the baby. We've had an increase in our sleep-related deaths in this county to the point that it's alarming to us. So what we do with model behavior
As a result of co-sleeping, or just in general?
Co-sleeping and loose bedding, pillows. People are just not, they hear the message, but it's not consistent enough. So what we have done is we've implemented model behavior, which is a program from First Candle and the American Academy of Pediatrics, where I actually go into the hospital and I'm educating the nurses in the newborn nursery, the neonatal intensive care units, labor and delivery pediatrics, the emergency rooms, any place where a mom may come in to have a baby or already have a child up to the age of 1 year. We're going in there and educating them about creating that safe sleep environment for the baby so that everybody is giving a consistent message across the board.
We have just a couple of minutes left, and I want to make sure that anybody watching knows that if they're pregnant, if they know anybody who's pregnant, or if they've just had a child, that there are resources available. Can you talk about how they can get Healthy Start services?
Absolutely. I mean, if they're just pregnant or just having their baby, they can certainly ask either their physician or in the hospital to fill out a Healthy Start screen. But that's not the only way to get into Healthy Start services. You can simply call our office, 954-563-7583 during regular business hours, and we'll be very happy to take your application over the phone and get you set up right away.
Great. And will you be starting another fatherhood class?
Yes, we will. Actually, after this one is over, I will be going into casework, still making sure the fathers are on the right track. But we are working towards expanding, and maybe next class taking in some teens fathers as well as older men.
Great. And what if they want to help? If somebody watching says, I want to be part of this to make our kids safer, our babies safer, how can they become part of Best for Broward Babies?
I say pick up the phone and call us. You can call Healthy Mothers, Healthy Babies at 954-765-0550, or we have a great website. It's b4bb.org, and it's loaded with tons of information, and we want everybody to be involved because I always say, and everybody laughs, but it is all about the babies because it's not just their baby, it's our babies, and we need to take care of our babies because a community's infant mortality rate is a true reflection of the community's health as a whole.
That's a perfect closing statement. I couldn't have said it better, Jennifer. Thank you so much. I'd like to thank Jennifer Combs, Sam Brown, and Donna Sogigian, as well as Dr. Roslyn Osgood and Sharetta Ramicki for their input in this important discussion on saving babies' lives. Please stay tuned for an important public service announcement on the Best for Broward Babies campaign immediately following this program. I've been your host, Cindy Arenberg-Seltzer, President and CEO of the Children's Services Council of Broward County. For copies of this program or any other episode of Future First, please call the Children's Services Council at 954-377-1000 or visit www.cscbroward.org. And remember to join us next time on Future First, focus on Broward's children.
Last year in Broward, close to 300 babies died before celebrating their first birthday. We can change that. For important information, please visit www.b4bb.org/300 or call 954-765-0550. It's all about the babies.